OCD, Obsessive Compulsive Disorder.
The Western Psychiatric Institute and Clinic, Pediatric, Obsessive Compulsive Disorder, Intensive Outpatient Program. It's a program that treats children from the ages of 6 to 18 in a group setting. Back in 2006, Dr. Andrew Gilbert, when he graduated from residency, decided that he really wanted to work with OCD kids and felt that an intensive outpatient program would be the best method of working with kids.
So obsessive compulsive disorder is an anxiety disorder, and it's generally characterized by people having obsessive and intrusive thoughts. It's characterized by compulsions, and those are generally ritualized behaviors that people sort of feel forced or compelled to do. And generally people do these compulsions as a way to get rid of the thoughts, those obsessions.
The door is open. You need to lock it. The door is not locked. Go back to the door. Go back and reread. You don't remember what happened. There are still germs on your hand. You're going to get a disease. You're going to die.
Some of the popular misconceptions people have about OCD, one that comes up is that lots of people will talk about, oh, I'm OCD, or, that if I'm a neat freak, I'm OCD, or, if someone needs something to be a certain way, he or she's OCD. That really isn't what it is, and OCD is actually something that really affects people's lives.
At the program, our primary method of treatment is cognitive behavior therapy, and we focus on exposure response prevention, where children come in and create a hierarchy of anxieties, and they start to expose themselves to the things that they fear most, and they learn how to be anxious so that they can manage their symptoms. On average in our program, we see between 40 and 50 kids per year.
There's probably less than 15 of these intensive outpatient group programs treating OCD in the country. A lot of people coming to look for treatment here from different states. We've had people come from West Virginia, Ohio, Indiana. People come down from Erie, PA, and that's because we're providing a really specialized kind of treatment that works, we'd like to say, really well. We have 2 psychiatrists here who can talk to families about medication if they're interested. I think another thing that really makes our program special is the parent support group that's run here, and actually Sharon runs that parent support group.
So I meet with the families once a week and just provide them with general education about OCD, talk about what's going on in the group room, how they can help their children at home.
Children or teenagers that have been in treatment for a little while, you actually see them sort of help each other get through treatment.
I don't think I've ever seen anybody walk out of the program here without gaining something from being in the group. The program operates 3 days a week for 3 hours each day. We operate on Monday, Tuesday, and Thursday.